The Proximerge Molar Implant System, Grant Dental Implant Suppliers, UK. Hello, and welcome to this presentation demonstrating a unique molar implant system designed to biomimic the shape that nature intended when replacing a missing molar. This illustrates the gingival flap with the tissue retracted, exposing the mandibular bone, where the screw-retained platform guide has been secured. The final shaping of the axial walls and floor of the osteotomy box is finished. The platform is now secured by the implant properly inserted. A final X-ray is exposed and the patient is instructed on care of the surgical site. Remove the tissue former, and the healed and healthy tissue is now ready for the crown prep abutment. The abutment comes in 5 heights. Choose the one that best accommodates the intra-occlusal space and opposing teeth. Use the plastic abutment try-in to confirm the appropriate height of the abutment prior to selecting the crown prep final abutment. This titanium abutment can be modified, contoured, and customized to adapt to the patient's tooth morphology and anatomy. Generally, very little adjustment will be necessary, and ideally, any adjustment should be done outside of the mouth. The dental lab technician works on an ideal abutment that has 6-degree tapered walls for retention, visible chamfered margins, and anti-rotational notch for orientation on the occlusal table, and the flexibility to modify the abutment if necessary by providing a reduction coping at the time of seating. There is no need for extra steps and additional costs such as manufacturing a custom abutment or increased expense to purchase an implant lab analog or transfer abutment, but instead the model provides an ideal crown prep abutment with the appearance of a prepared natural tooth that will be used to produce a final restoration with anatomically correct contours and morphology. In this particular case, an impression material was used and a mandibular case model was produced. The final crown restoration was produced on the model like a typical crown abutment without the standard implant transfers and analogs. The contours are anatomically and morphologically similar to a natural tooth emerging from the bone. This provides the dental lab technician the opportunity to biomimic a natural tooth without over-contoured and bulbous porcelain that is unsupported and susceptible to fracture. The mesial contact provides for an embrasure that is easily cleaned by the patient and not prone to trapping food and plaque. The final product looks and feels like a natural tooth and offers the patient a far healthier option that functions the way the tooth did before it was removed, while mechanically distributing the occlusal and tensile compressive forces more evenly into the bone and surrounding tissues. The final crown is cemented onto the crown prep abutment using the conventional appropriate implant cement. A small bead of cement is placed inside the cervical rim and seated. Care is taken to meticulously remove any extruded cement around the margin or tissue. Any cement used should be radio-opaque and a final X-ray taken, and one last check to make sure the cement is cleaned away from the margin and tissue. Oral hygiene instructions are emphasized to the patient for this implant as well as all of the teeth. Thank you for watching the Proximerge Molar Implant surgical demonstration of the lower left first molar and restoration. You can find out more about our system and company by visiting our website at Grant Dental Technology Corporation or Google Proximerge and find us on Facebook and like us on Twitter to keep up with all the new innovations we are posting. This is Dr. James Grant, and thank you again for watching.